performance of the federal government in protecting worker safety during the COVID-19 pandemic. I want to thank OSHA Deputy Assistant Secretary Sweat and NOSHA Director Howard for joining us today. The COVID-19 pandemic has resulted in the worst worker safety crisis in OSHA's 50-year history. Nothing compares. In the past 4 months, more than 62,000 healthcare workers who we've asked to risk their lives without protective equipment have been diagnosed with COVID-19, and at least 291 have died. And this is an underestimate. According to CDC, these shocking numbers are a mere fraction of the true toll due to the absence of reporting by as many as 27 states, New York City, and the District of Columbia. And as we know, infection outbreaks have not been limited to healthcare facilities. More than 17,000 meat processing workers have been infected, and estimated 66 have died. One Iowa Tyson plant saw 60% of its employees test positive. A Greeley, Colorado meatpacking plant closed after hundreds fell ill, although the plant promised to test every worker before reopening. The plant identified so many positive cases that it stopped testing and reopened anyway. Prisons, long-term care facilities, grocery stores, transportation systems, and warehouses have all experienced deadly outbreaks. Earlier this month, the CDC reported 2,778 infections and 15 deaths among staff employed in correctional and detention facilities. From late January to late April, fully 36% of all reported infections at correctional facilities were suffered by staff. At least 6 employees of one warehouse in New York have died from COVID-19. 129 New York City transit workers have died of the virus. As of last week, 1,424 Veterans Administration employees have been diagnosed with COVID-19, and 31 have died. Some 2,400 postal workers have tested positive, and 6 have died from COVID-related illnesses. United Parcel Service is facing an outbreak of 36 cases at its facility in Tucson. But as we will discuss today, we don't really know the toll to workers because this nation has no system for collecting data on COVID-19 infections in the workplace. And employers are not obligated to publicly report these infections. Some government agencies refuse to make this information public due to employer concerns about adverse publicity, leaving workers and the public unaware of what risks they are facing. We cannot lose sight of the fact that this is largely a tragedy inflicted on our nation's essential workers. People who don't have a choice on whether they have to go to work. People who don't have a choice on whether or many of those are on the frontliners. They're low-income workers and disproportionately people of color who don't have the luxury of teleworking from home. COVID-19 is largely a workplace disease and a community tragedy. In Iowa, Nebraska, South Dakota, coronavirus cases linked to meat workers represent 18, 20, and 29% of the state's total cases, respectively, according to the Environmental Working Group. My home state of North Carolina leads the nation with the number of meatpacking plants facing an outbreak, with the State Department of Health and Human Services reporting that at least 23 plants have outbreaks with more than 1,300 worker infections. Yet OSHA, the agency that this nation has tasked to protect workers, have been largely invisible. It's failed to develop the necessary tools that it needs to combat this pandemic, and it has failed to fully use the tools that it has. instead focusing principally on issuing press releases and voluntary guidance. This hearing will focus on why that is and the price that this nation's workers are paying for OSHA's inaction. Deep into this pandemic, OSHA has still not developed any enforceable standards for employers to follow that can protect workers from the airborne transmission of the novel coronavirus. And OSHA's existing enforcement tools to combat this pandemic, which include standards covering respirators and personal protective equipment, are inadequate and unused. While guidance issued by the Centers for Disease Control and Prevention can be useful, it's not binding. Only OSHA can enforce safe working conditions. And although OSHA says it uses its enforcement authority to protect workers, OSHA's own data shows that the majority of its inspections are conducted only after workers have died. And OSHA has conducted complaint inspections for less than 1% of the complaints filed. While the Secretary of Labor says it does not need an emergency temporary standard because OSHA already has the tools that it needs to enforce its guidelines through the General Duty Clause, the embarrassing truth is that OSHA has not issued a single citation under the General Duty Clause to enforce that guidance. Not one. This worker safety crisis was clearly foreseeable, and OSHA was warned. It was clear after the H1N1 swine flu, that the pandemic in 2009, that an infectious disease standard was needed that requires employers to access the infectious disease risks in their workplaces and mitigate the hazards. Such a hazard as well along the way at the beginning of the Trump administration, but in February 2017, that draft standard was mothballed and relegated to the long-term regulatory agenda where it languishes today. On January 1, I joined Chairman Bobby Scott in calling on OSHA to put the infectious disease standard back on the active agenda. In that letter, we also urged OSHA to issue a compliance directive for the healthcare sector and to issue an emergency temporary standard if the situation deteriorated. At the time of our request, there were just 5 confirmed COVID-19 infections in the U.S. Hearing nothing back, on March 5th, we wrote OSHA again, describing how hundreds of healthcare workers had been exposed, and stated the obvious, that OSHA urgently needed to issue an emergency temporary standard, an ETS. In mid-March, OSHA rejected an ETS on the grounds that the healthcare industry fully understands the gravity of the situation and is taking the appropriate steps to protect its workers. In April, with more than 720,000 infections nationwide, OSHA finally issued enforcement guidance, but only covering the healthcare sector. In mid-May, as workers continue to face risks of infection, illnesses, and death, the agency is still refusing to issue an emergency temporary standard to protect workers from exposure to coronavirus. And here's what OSHA Act says. It says, shall provide for an emergency temporary standard if it determines that employees are exposed to a grave danger from new hazards and that such emergency standard is necessary to protect employees from such danger. Circumstances like this pandemic are the exact reason that this authority exists, yet OSHA continues to sit on the sidelines. So my question to the Secretary of Labor is how tens of thousands of workplace infections and hundreds of worker deaths, why is OSHA missing in action? Failure to take meaningful action has set a clear message to workers across the country that they are on their own. On Friday, May 15th, the House of Representatives passed the HEROES Act, H.R. 6800, which included COVID-19 Every Worker Protection Act, introduced by Chairman Scott, Representative Shalala, and myself. The bill directs OSHA to issue an emergency temporary standard with 7 days to protect workers in hospitals, meatpacking plants, and retail stores. restaurants and offices and shipyards and other workplaces where a person may face risk from exposure. The HEROES Act would also prohibit employers from retaliating against workers. As the states across the country begin to reopen, more workers will be at risk of infection unless OSHA starts doing its job. And if the reopening of workplaces drives up infection rates, states will be forced to reinstate stay-at-home orders, which do further damage to our economy. The only logical conclusion I can draw is that OSHA's inadequate response to this pandemic has been informed more by politics rather than modern science. The necessity to protect workers should not be cramped by state ideological notions about regulation, nor campaign slogans about repealing 2 regulations for every new one that's created. Today we will explore and hopefully answer why there's been a lack of political will in the face of this public health disaster, and we'll learn why no one seems to care enough to even track the number of workers who are getting sick and dying. And finally, I feel the need to respond to 2 items in Ms. Sweat's written testimony. First, we note that because of a lawsuit, Ms. Sweat will refuse to answer any questions about an emergency temporary standard. And I want to note for the record that there's no legal basis for this refusal. It's purely a political statement. And secondly, I want to respond to Ms. Sweat's testimony, which implies that criticism of OSHA's failure to issue an emergency standard or enforce existing standards does a disservice to the hardworking men and women of OSHA. And no one has more respect for the dedicated men and women, or the dedicated staff of OSHA and the hard work that they do every day than this committee, as evidenced by our advocacy for the agency's budget and the opposition to the torrent of rollbacks to worker safety protection. The failure to completely address the life-threatening hazards that working Americans are facing from COVID-19 is not the fault of OSHA professional staff, but rather due to the unfortunate decisions of OSHA's political leadership. I would like to now yield to the ranking member, Mr. Byrne, for his opening statement. Mr. Byrne, you are recognized.
Thank you, Madam Chairman, for yielding. Let me state for the record that the chairwoman is here physically present in this room. The chairman of the full committee, Mr. Scott, is physically present in the room. The ranking Republican member on the committee is physically present here in the room. I'm physically present here in the room. In fact, there are 15 members of this committee physically present in the room, 9 Republicans, 6 Democrats. It is a safe environment, a simple environment. As you can tell, we are socially distanced. Not much has changed since the Democrats decided at the 11th hour to unilaterally call off last week's hearing. OSHA and NIOSH officials, my Republican colleagues, and I were ready then to talk about the important work these agencies are doing to combat COVID-19, and we are here again to do so today. It is indeed unfortunate the Democrats decided to play politics on an issue that they assert is a top priority. The COVID-19 pandemic has been an extraordinary time for all Americans. Many of us are coming out of mandatory stay-at-home orders after 2 months or more. People are returning to work in a new environment with a disease that is still relatively new and about which we still have much to learn. We know the disease affects different people in different ways. Many people who test positive have no or mild symptoms, but a small percentage get very ill, and some of them, unfortunately, pass away. The 2 groups most likely to become very ill are those over 65, who make up 80% of all deaths in this country, and those with underlying health conditions as listed by the CDC. The disease also presents varying levels of risk for workers in different types of jobs. For example, an office worker who doesn't interact with the public faces much lower risk than a nurse in an ICU ward. I say all of this to make a point about the inherent difficulty in coming up with a reliable, single standard for workplace safety, whether it's for infectious disease in general or COVID-19 specifically. How did OSHA handle complex safety and health issues in the past? From SARS in the 2000s during the Bush administration to MERS, H1N1 influenza, and Ebola during the Obama administration, OSHA did not issue a new standard, but instead enforced existing standards and issue guidance, which in turn could be the basis for action against an employer under the General Duty Clause of the OSHA statute. Let me say that again. During the Obama administration, under 3 separate diseases, OSHA did not issue a standard. They issued guidelines and relied upon those guidelines for enforcing the General Duty Clause. When the acting assistant secretary for OSHA during H1N1, which the chairwoman referred to, during that pandemic, a man named Jordan Barab, when he testified before this committee in May of 2009, he said OSHA had created guidance, quote, to help employers determine the most appropriate work practices and precautions to limit the impact of the pandemic. He went on to say, because safety risks are greater in certain workplaces, OSHA is focusing its direct efforts on educating employers and employees in the high-risk exposure categories. At that time, he said OSHA issued an occupational risk pyramid to categorize workers' risk, which demonstrated that only a small portion of employees were at the highest exposure risk level. Mr. Barab specifically referenced standards already in place for personal protective equipment and respirators. He said that OSHA would use the General Duty Clause, quote, to ensure that employers follow the practices that public health experts agree are necessary to protect workers' health. Finally, he quoted President Obama's assessment for the situation as being, quote, one for cause for deep concern, but not panic. What has OSHA done with COVID-19? Just like the Obama administration, it has issued detailed guidelines, placed an enforcement emphasis on high-risk workplaces, used an occupational risk pyramid categorizing workers' risk, and reminded employers of OSHA's existing standards on PPE, respirators, sanitation, and others, as well as their obligations under the OSHA Act's General Duty Clause to provide employers with a safe and healthy workplace. In addition, OSHA and the CDC have issued industry-specific guidance for healthcare, nursing home and long-term care, retail pharmacy, car service, package delivery, retail, construction, manufacturing, restaurant, and dental workplaces. And they're still working on it. There are 2 problems with requiring a standard. First, we are still learning about this disease, and we just don't know enough information to meet the level necessary and appropriate to construct an adequate emergency temporary standard and a permanent federal regulation. That's why the various guidance documents already issued are so useful. They can be issued relatively quickly and modified as we learn more from the CDC and other public health officials and from the workplaces themselves. A standard at this point would be an unproductive burden for businesses already struggling to reopen, potentially exposing them to unnecessary liability risks during an already challenging time, and would do little to advance workplace safety. Second, setting a standard just takes too long. On average, it takes OSHA 7 years to compile all the data necessary and meet all the regulatory requirements for issuing a standard. I know Democrats want an emergency temporary standard, or ETS, which, according to their bill, must be done in 7 days. The last time OSHA issued an ETS was in 1983, and that one was overturned because OSHA could not meet the statutory threshold requirements for issuance. Indeed, OSHA has lost more ETS cases in federal courts than it's won for the same reason. I know the Speaker included a provision requiring a standard in the bill passed by the House 2 weeks ago, a bill she created in her office without any consultation with the White House or the Senate, and on which we never had a hearing or markup in this committee, the Committee of Jurisdiction. No regular order and no effort to obtain bipartisan consensus. That's no way to operate the House with a challenge of this magnitude posed by the pandemic and our response to the pandemic. No wonder that bill is dead on arrival in the Senate. I also know the AFL-CIO filed a lawsuit last week to force OSHA to issue a standard. They filed a lawsuit. Expensive and time-consuming litigation against the federal agency responsible for protecting our nation's workers in the midst of a pandemic is unhelpful and very unlikely to succeed. And Madam Chairwoman, I take exception to your remarks about the witness's ability to talk about that lawsuit, matters involved in that lawsuit. No lawyer is going to let their client talk about something like that with pending litigation. It's a matter of every lawyer that has a client litigation like that is going to ask them to be careful about that. And to expect them not to follow their lawyer's advice is totally unfair to them. I must say that when I started preparing for this hearing with my staff 2 weeks ago, I was impressed, very impressed, with the diligence and speed with which OSHA has fashioned its response. Remember, we didn't even know about this disease 5 months ago. Their experience with past pandemics surely helped, and I'm glad they both followed and built upon this experience. I've talked with hundreds of businesses trying to decide whether and how to reopen, and that's probably true for every member in this room. Those conversations always include a real concern for the health of their employees. They've consulted CDC, they've consulted local and state public health officials and their industry organizations, and yes, they are closely following this OSHA guidance, which they are truly grateful for. They want to provide their employees a safe workplace, and OSHA is helping them achieve that. Isn't that what the OSHA statute's purpose is? Helping employers and employees keep their workplaces safe and healthy? I'm looking forward to the testimony today, and I thank the witnesses for appearing in the midst of what I know is a very busy time for them. Let's all work together to protect the most important part of the American economy, the working men and women who make this country so very prosperous, including the healthcare workers, like my sister-in-law, Cynthia Dukes, who is an ICU nurse. I want her to be safe and healthy as she goes about her extremely important work, even as we sit here taking care of the sickest of us. She and her colleagues deserve nothing less, and they are best served by us when we work together for them and not for special interests, and we stop the wasteful litigation and the partisan legislative games. America will get through this. We can protect our people who are most vulnerable to this disease and reopen the American economy safely as we start on another road to recovery and prosperity for all. President Obama was right. There is cause for great concern, but not panic. And if OSHA's response was the best way to go for SARS, MERS, H1N1, and Ebola, why is it not best for COVID-19? Thank you, and I yield back.
I want to thank the ranking member, but I just want to respond for a moment. Mr. Byrne, Obama started work on a permanent airborne disease standard, and Trump put it back on the back burner, and still after 100,000 deaths, it's still pending. So votes are going to be called in 5 minutes, but let me introduce the witnesses. Any other members who wish to insert written statements into the record may do so by submitting them to the committee clerk electronically in Microsoft Word by 5 p.m. on June 10th, 2020. Let me introduce the two witnesses before we'll have to take a break. Our first witness will be Ms. Lauren Sweat. Ms. Sweat is the Principal Deputy Assistant Secretary for the Occupational Safe and Health Administration. She joined OSHA on July 24th, 2017, coming from this committee, where she was Senior Policy Advisor at the Committee on Education and Workforce for 15 years. In that role, Ms. Sweat handled workplace safety issues before the committee, including OSHA and the Mine Safety and Health Administration. Our next witness will be Mr. John Howard, Dr. John Howard, Dr. Howard is the Director of the National Institute for Occupational Safety and Health. He's held that position since 2009. Dr. Howard previously served as Director of the Institute from 2002 to 2008. Prior to coming to NIOSH, Dr. Howard was chief of the Division of Occupational Safety and Health for the California Department of Industrial Relations, Labor, and Workforce Development. I'm going to, do we adjourn now? Okay, we're going to proceed with the hearing and with the witness testimony. So we appreciate the witnesses for participating today, and we look forward to your testimony. But let me remind the witnesses that we've read your written statements, and they will appear in full in the hearing record. Pursuant to Committee Rule 7D and committee practice, each of you is asked to limit your oral presentation to 5-minute summary of your written statement. And let me remind the witnesses that pursuant to Title 18 of the U.S. Code, Section 1001, it is illegal to knowingly and willfully falsify any statement, representation, written document, or material fact presented to Congress, or otherwise conceal or cover up a material fact. Before you begin your testimony, please remember to press the button on the microphone in front of you so that it will, in turn, the members can hear you. And as you begin to speak, the light in front of you will turn green. After 4 minutes, the light will turn yellow to signal that you have 1 minute remaining. When the light turns red, your 5 minutes have expired, and we ask that you please wrap it up. We will let both witnesses make their presentations before we move to member questions. When answering a question, please remember to once again turn your microphone on. Ms. Sweat, we're going to first recognize you.
Microphone on.
Was on, sorry. Thank you for the opportunity to highlight the Occupational Safety and Health Administration's important work of protecting our nation's workers. I'm proud of the work this agency has done during the Trump administration, but I'm particularly proud of the work it is performing right now as it responds to a worldwide health crisis. The work of the agency continues uninterrupted even as we respond to this pandemic. Between February 1st and May 21st, OSHA received over 5,000 non-COVID-19 complaints and conducted 5,009 investigations based on these complaints and 969 inspections. During this time, OSHA has also received over 2,300 non-COVID-19 whistleblower complaints, which are being evaluated along with the COVID-19 whistleblower complaints. I'm so proud of the dedication to OSHA's mission of our hardworking compliance safety and health officers and all of the agency's personnel. Our COSHOs are initiating thousands of investigations of complaints. Our compliance assistance staff are working with employers across the country to help ensure safe and healthful working conditions for the nation's workers. Our training and education staff have moved quickly to provide training to COSHOs. And before, during, and after the pandemic, my goal is for OSHA's efforts to prevent workers from ever becoming ill or injured because they are doing their job. OSHA's efforts to address COVID-19 has been its top priority since February. OSHA quickly pivoted to focus intensely on giving employers and workers the guidance they need to work safely in this rapidly changing situation. Where appropriate, OSHA has also enforced safety and health standards. Throughout this crisis, the incredible men and women of OSHA have remained committed to carrying out their mission to keep America's workers safe and healthy. OSHA's initial response to the pandemic was to provide extensive guidance, often in conjunction with the CDC. Guidance has allowed the agency to be more nimble in response to the ever-changing understanding of the virus. OSHA continues to issue industry-specific alerts that provide targeted guidance on practices and procedures that will help workers' health and safety. To date, OSHA has issued general industry guidance, and it has also issued guidance documents to protect workers in numerous specific industries, including meatpacking and processing, healthcare, nursing homes, restaurants, dentistry, and manufacturing. OSHA has also distilled its extensive guidance into a wide variety of usable worker education segments available on OSHA's website. While extensive guidance is important to the rapidly changing dynamic of this pandemic as it continues, it is important to recognize OSHA's existing standards serve as the basis for its COVID-19 enforcement. Those standards include rules regarding respiratory protection, personal protective equipment, eye and face protection, sanitation, and hazard communication. In addition to those existing authorities, OSHA has also the ability to take appropriate action against employers under the OSHAC's General Duty Clause. OSHA was recently sued by the AFL-CIO for an emergency temporary standard, and as we have discussed today, I cannot comment further surrounding the ETS or litigation. The flexibility and responsiveness allowed through guidance is apparent in the 2 revised enforcement policies issued last week by OSHA. As states are beginning to reopen their economies, OSHA is acting to ensure employers are protecting their employees. First, OSHA is increasing in-person inspections at all types of workplaces. Second, OSHA is clarifying its previous enforcement policy for recording cases of coronavirus. Under the new policy, OSHA will enforce record-keeping requirements for employee coronavirus illnesses for all employers. But to repeat, OSHA will not use guidance as a substitute for enforcement. Rather, the agency has the tools and intent to pursue both avenues. Where there are safety issues, OSHA remains, as always, shoulder to shoulder with America's workers. OSHA is charged with protecting the rights of whistleblowers under 23 statutes. As the Secretary of Labor has made clear from the White House podium, multiple national interviews, and additional conversations with stakeholders, retaliation against workers is unacceptable. In this pandemic, OSHA inspectors are initiating thousands of investigations. This is resulting in employers receiving up-to-date information about how to better protect their workers. During the same time, OSHA inspectors continue to respond to non-COVID-19 worker fatalities and complaints. Through the tireless efforts of the entire agency, OSHA's continuous outreach and communication to workers and employers, and its issuance of important guidance, OSHA is on the job protecting America's workers. I'm happy to answer any questions you may have.
Thank you, Ms. Sweat. Dr. Howard, you have 5 minutes, sir.
Good morning, Chairwoman Adams and Ranking Member Byrne, Chairman Scott, and Ranking Member Fox. My name is John Howard, and I'm the Director of the National Institute for Occupational Safety and Health, which is part of the Centers for Disease Control and Prevention in the U.S. Department of Health and Human Services. I'm pleased to provide the subcommittee information about the COVID-19 response activities undertaken by NIOSH over the past few months. To date, just over 1.6 million cases of COVID-19 have been reported to CDC. Many of these cases are in working-age adults. For example, as of today, May 28th, there have been 62,690 cases of COVID-19 among healthcare workers, with 294 deaths. However, the total number of healthcare worker cases is likely to be an underestimate due to data collection challenges arising from the pandemic. Currently, CDC and NIOSH are actively working to address the issue of capturing occupational data as it relates to COVID-19 cases. A new case report form released on May 5th added questions about workplace exposures for healthcare workers and workers in other critical infrastructure industries. States have been asked to start using this new form by May 15th. Activities by NIOSH as a part of CDC's response to COVID-19 fall into 3 main categories. First, respiratory protective devices. Through NIOSH's National Personal Protective Technology Laboratory, NIOSH is responsible for establishing criteria, testing, and certifying respiratory protective devices, including filtering face-piece respirators. The most common type is the N95. During the global supply shortage caused by the pandemic, NIOSH and CDC have taken steps to increase the supply of available certified respirators by, 1, supporting existing NIOSH respirator approval holders to increase their ongoing production, 2, quickly evaluating new domestic respirator applications for approval, 3, providing up-to-date guidance, especially with regard to respirators made by non-U.S. manufacturers, and 4, tripling respirator approval decisions.
Yeah,
To expand the range of respirators available to healthcare workers, NIOSH works with FDA on its emergency use authorizations, which can significantly expand the inventory of respirators available for use in healthcare settings by, one, permitting the use of powered air purifying respirators, or PAPRs, elastomeric respirators, and other NIOSH-approved filtering facepiece respirators besides the N95 that had not been previously cleared by FDA for use in healthcare settings. Second, permitting the use of stockpiled respirators that had exceeded their rated shelf life. Three, permitting the use of certain respirators from foreign countries approved under the performance standards in those countries. And four, permitting the reuse of certain decontaminated filtering facepiece respirators. Second, field survey support for state health departments. NIOSH deployed staff to 34 states and 18 poultry, 11 beef, and 5 poultry processing workplaces representing 15 separate companies. The number of cases of COVID-19 in meat processing is significant. NIOSH has reviewed plant facilities, processes, operations, CDC's epidemiologists and partners from state and local health departments, evaluated plant and community infection control plans through various methodologies. A typical site visit examines multiple features of the plant's operations. Third, guidance. NIOSH has, through the Emergency Operations Center at CDC, worked with our partner agencies, including OSHA, the Department of Agriculture, and the Department of Transportation, to produce numerous guidance documents and fact sheets for employers and workers in various industries and occupations. For example, CDC and OSHA have co-authored interim guidance for the meat and poultry packing industry and interim guidance for manufacturing workers and employers. Thank you again for the opportunity to participate in today's hearing. I look forward to answering your questions.
Thank you very much.
I think we're going to go vote and then come right back. Can't do that?
They called for votes, so we're going to go and vote in vote rotations until we get further information. I'm on that first rotation, so Mr. Scott, will you? Well, that's what I was trying to do, get everybody to go vote.
We apologize. We're hoping to go vote all at the same time, but apparently that's, we don't have permission to do that yet. First question will be the gentleman from California, Mr. Takano.
Thank you, Mr. Chairman, and thank you, Chairwoman Adams, for organizing this critical hearing on the need to protect workers from coronavirus. The role of the Occupational Safety and Health Administration is to, quote, ensure safe and healthful working conditions for working men and women by setting and enforcing standards, end quote. During this current pandemic, where nearly 1.5 million people have been infected with COVID-19 and nearly 100,000 people in this country have died, OSHA has completely abandoned its responsibilities and is not holding up to its mission. The General Duty Clause of the Occupational Safety and Health Act requires employers to provide employees with, quote, "a workplace free from recognized hazards likely to cause death or serious physical harm," end quote. And based on my review of the nearly 5,000 COVID-19 related complaints filed by workers, it is evident that many employers are not making good faith efforts to protect their workers. Ms. Sweat, is OSHA prepared to conduct mandatory on-site inspections in response to worker complaints that allege serious health violations, not just for those complaints that result in a fatality?
Yes, OSHA is working proactively since the beginning of February to address the COVID-19 hazard. We have, as you said, over 5,000 complaints, and our inspectors are investigating all of them, where they are getting information from employers that is not adequate. They are opening investigations. And so, yes, the agency has been doing its job since the beginning of this pandemic.
Do you have enough inspectors to be able to do this in a timely manner?
I think folks know that we've been actively trying to hire investigators since August of 2017. We are appreciative of Congress providing us more funding so that we can hire 50 this year. Until March of this year, we were in an unprecedented competition with the private sector to find and hire adequate workers. This is a highly skilled profession, and we have been trying to get folks to come in and serve the mission of the agency. It's been something that's a priority of mine since I started in July of 2017, but it was very challenging with record low unemployment numbers to get people to come in with the skills that we need. So yes, we are pursuing more inspectors.
Ms. Sweat, how many, if I may, how many workers do you need, and how many positions remain unfilled?
Well, we have 50 that are funded by Congress this year that we're trying to fill. Even in the midst of this pandemic, we are actively recruiting folks to come and work for us, and we are seeing results. So we will work as hard as we can and as diligently as possible to hire those folks and get them through our process and get more people to have more boots on the ground.
Ms. Sweat, as the lead agency, how will OSHA work to enforce national policies for each agency that you work with and make sure rules are applied and followed uniformly from facility to facility?
Well, I think the question is about our engagement with our federal partners.
Yes.
And our folks are on about 10 federal task forces related to COVID specifically. We are engaged with NIOSH and the CDC to write these guidance documents that you've seen. The most important that we've issued lately is the meatpacking guidance. We issued construction on Monday. We're working on more as we identify industries that need to understand what we are requiring, and we will continue to do that to the best of our ability.
Ms. Sweat, just recently, I'm looking at the clock, and I just don't know. Rather than enforcing OSHA's rule, the Trump administration plan for opening up America again attempts to shift workplace safety preparedness to the states by highlighting the state's responsibility for the health and safety of workers in critical industries. Ms. Sweat, was OSHA consulted in preparing this plan?
All of those plans go through clearance, and I would say that they may be talking about the state and local health authorities, but OSHA is in approximately 26 states, and then there's 22 states with state
But
plans.
specifically, on the Trump administration's plan to open up on America again, was OSHA consulted in preparing this plan?
I do believe that OSHA participated in the clearance plan, yes.
You don't know for sure?
I do believe that we did, yes.
Does this approach effectively sideline OSHA in its role for protecting workers?
No, I do not believe it does.
Even though it highlights the state's responsibilities, I mean, it does not de-emphasize OSHA?
I do not think so.
Is this plan consistent with the OSHA Act?
As I said, federal OSHA exists in specific states, and then there are state plans of which we provide grant money to. So where we are in jurisdiction, we will be in enforcement mode, and we will be doing our job. I do not believe that that plan changes our obligations.
Thank you.
Thank you, Mr. Chairman. First of all, let me thank you again, both of you, for being here. I know you're very busy. Ms. Sweat, you heard me recite the testimony of one of your predecessors during the Obama administration, and so I want to ask you a simple question. How is OSHA's COVID-19 response similar or different from the approach taken by the Obama administration during the H1N1 pandemic?
We have followed the H1N1 pandemic strategy almost to the T. It's been very important for us to get the message out. We started as early as January with the Safety and Health Topics page. We provided general guidance for all industries so that they could plan to protect their workers. And as the pandemic has spread, we have provided industry guidance for very specific industries. And I think we are doing what we are supposed to do: enforcement, compliance assistance, and training and education of everyone that will come to us and work with us on our guidance. And I don't think that we've diverted from what the plan was with H1N1.
Can you elaborate on how OSHA has historically responded to emerging workplace hazards and why the agency has used compliance initiatives coupled with enforcement of existing standards, including the OSHA Act's General Duty Clause, as effective measures to respond quickly during a pandemic?
Thank you. I would like to say that we respond to a lot of different issues and have since I started in July of 2017. Natural disasters, hurricanes. Typically, in those situations, we suspend enforcement. In this instance, we proactively determined that we would stay in enforcement mode, and we would use all the enforcement tools available to us. One of those is the investigation for complaints. As we've noted, we've received over 5,000 complaints. And the approach that we've taken, and this gets us into the employer almost immediately, puts them on notice that someone has said there is a problem and that we are following up. It is one of the fastest ways to achieve resolution in this situation, to get the worker on notice, or the employer on notice, and the worker out of the hazard.
Thank you. Dr. Howard, what resources has NIOSH developed to educate employers and workers on how best to keep workplaces safe? And do you anticipate that NIOSH will continue to update this information?
Well, let me take the second question. The answer is definitely yes. Our guidance changes rapidly, and I always tell people, don't print out CDC guidance from your printer because it may be out of date the next time you go to the website. This is a rapidly evolving situation, so our guidance changes pretty much every week and sometimes every day. The first question, we do a lot of educational guidance with regard to both these congregate working situations, which are at highest risk, such as a nursing home, a meatpacking plant, situations in which congregate commerce occurs, where you have a worker and a customer close together. So we are doing a lot to educate the worker and the employer on these situations.
Good. So, Ms. Sweat, let me go back to you for a second. We're beginning to see a lot of businesses reopen, which I want to say I think is a very good thing. So how does OSHA plan to engage with employers and workers, as Dr. Howard said, to ensure successful workplace safety outcomes?
We're going to continue providing guidance, and as folks look to reopen, we will be working, or we are actually working on reopening guidance, so that when employers are looking at what they're going to do to protect their workers, we can explain how that intersects with our existing standards and regulations and what they need to do in order to be in compliance as they go forward. But the existing guidance that we have, that we've worked with NIOSH and others, really does provide a very productive roadmap for what employers should be doing as they look to reopen their businesses.
And Dr. Howard, I think you kind of alluded to this earlier. Let me go back to you about this, but CDC and all the rest of us are learning about this disease like literally something new every day. So as you issue new guidance, you're taking into account what CDC and other people are telling you. But as you said earlier, it's happening so rapidly, you don't even print it out. You just put it on and know you're going to have to change it the next day. How difficult does that make it for both of you to actually try to come up with a, quote, standard as opposed to guidance?
I think it's very difficult. Guidance is, as you mentioned, an easier pathway. based on the best professional judgment and hopefully the best science that we have. And it can be easily done, although the review process is long and detailed, as it should be. But when we learn something new, that guidance can be changed almost instantaneously. In the case of the meatpacking guidance, which we and OSHA put together, one of the big issues now is establishment level testing. Well, that's not really something that we put in the current edition of the guidance, but we're beginning to think more seriously about how you do that, because as we know, many meatpacking processing plants are doing that kind of testing. So we're beginning to think about that. So in the next iteration of our guidance, we may have more information about testing.
Good, thank you, and I yield back.
As the COVID-19 coronavirus has made its devastating impact on this nation. 100,000 Americans have died from this disease, and the magnitude of loss is simply staggering. For those that we've lost and the millions of Americans who've lost someone, we continue to mourn. In this time of crisis, we've seen time and time again that everyday heroes simply live among us and from every part of our communities. Frontline healthcare providers working around the clock to treat our families, first responders, grocery store workers, essential employees, and delivery workers have all answered the call to ensure that all Americans can have access to vital services and goods during this period.